Hello.
Hey, Steph, it's good to see you.
Hey, yeah. How's your night been?
Oh, it was slow earlier, but it's got kind of busy. We have a patient in room 401. Her name's Carol. She's a 62-year-old female. She's a full code. No allergies. Her admitting diagnosis was a left-sided stroke, so she has some right-sided weakness. And her past medical history is hypertension and diabetes type 2. Her doctor is CT scanner. So when I came in to assess her initially, she was barely arousable, wouldn't even barely arouse to painful stimuli. I could barely understand her. They did vitals at midnight, and the blood pressure was 210 over 122. Heart rate was 88. Respirators were 12, and her temp was 36.8. I'm kind of concerned about some intracranial bleeding or potential hypoglycemia.
Did you say what meds she's on?
No, I didn't. She has metoprolol, and she also takes insulin Lantus, and then she takes Novolog for the low dose sliding scale.
All right.
And yeah, so I consulted neurology. They're on their way up here. I hesitated to call rapid response. I wanted to bring you in here. I knew you were almost coming in, so I wanted to assess her together first. And we'll see how that goes, see if her condition has improved after we gave her medications about an hour ago.
Okay, let's go check on her. Knock, knock. Hello, Carol. I'm Stephanie. Hello, Carol. Sternal rub. Oh, hello. Hi. Can you, I'm going to do a pupil assessment just to kind of see. Can you feel this? Can you talk to me? Can you nod your head? No? Just open your eyes. Can you squeeze my hands? Hey, I'm going to get the UAP to get a set of vitals on her and some blood sugar.
We can do her vitals, but we can get the UAP to do her blood sugar. That way, just in case of her stability and everything.
Yeah, you're right.
Because I almost did the same thing, and then I was like, wait a second, I better take care of this.
I'll get her blood pressure here. Well, she's still, her respirations are still a little low, and her blood pressure went down a little bit, but it's still pretty high.
Update from UAP, blood sugar's 40.
Oh goodness. Well, let's see. I think we got some dextrose we can give her. Can you push on my hands? I think we're gonna have to call rapid response and get them up here and kind of check her out. Call rapid response. They get in here. They kind of stabilize her. They're working with her. I gave her a report. Things are getting better for Carol. All right.
Good? Okay.
Okay.
Okay, so before we go in, the next patient that you might want to see, her name is Agnes. She's an 88-year-old female. She's a DNR. She is allergic to aspirin. She has a admitting diagnosis of congestive heart failure.
Okay.
And her past medical history includes coronary artery disease, hypertension, and 2 MIs.
Okay.
So she is taking simvastatin, and she also takes a lisinopril, losartan, and propranolol.
Okay.
So and
she's
warfarin, excuse me.
Okay.
Warfarin.
Okay. So she was having some trouble breathing. Did you say that?
Yes.
Okay.
I
already looked at her chart. I was kind of looking at the notes.
Okay. I'm glad you prepared. That's
Yeah.
good use of your time.
Thank you.
Her doctor is Dr. Dryan. So yeah, she did complain about breathing. We did her O2 stats were 96, but the doctor did put it in order for 2 liters nasal cannula if they go below 90.
Okay.
We raised the head of bed and put a couple pillows behind her to help her breathe. So if you want to go in, we can go meet her.
Knock, knock. Hello. How's it going in here? Good. I heard you were having some trouble breathing earlier. How's that going?
It's better.
Are you still having some trouble breathing?
A little bit.
Okay, well, I'm just going to use my stethoscope and listen to your lungs and your heart and all that. I'm going to take your vitals and get your oxygen saturation.
So vital sign 72.
I'm gonna feel your pulses here,
Heart
see
rate's
how
98. Blood pressure's 100 over 60.
how that's going. Check for some edema. And her lungs sounded a little bit crackly.
Okay.
So we're gonna give her. Does she have Lasix?
Oh, she does have
available?
Lasix,
We're gonna
yes.
give you some Lasix to help get that water out, and we'll put the head of your bed up some more. It's broken, but whatever. And your oxygen saturation is at 90 right now, so I'm going to put you on some oxygen.
I'm gonna put you
Okay,
on
Hopefully that'll help.
right now, and I'm gonna.
Is Lasix the one that makes me pee all the time?
Yeah,
So,
it is. Are you able to get up and walk to the
that, and
bathroom?
while I'm doing
Yeah,
that, listen to this
I
first
am.
Okay, we'll just call us when you get up, okay?
I will.
Alrighty.
Thank you.
You're welcome. I'll be in
Okay.
later to check on
I'm
you.
gonna call the
Okay.
doctor right now. and
Agnes,
let
it
him
was
know what's
nice
going
working
on.
with you.
Oh, you were
feeling
lovely.
better.
Thank
Hey,
you so
Doctor,
much.
this is
You're
Lexi, the
welcome.
nurse on 7 North.
Okay.
The patient,
The last patient is Bill. He is 57-year-old male, full code. He's allergic to Benadryl. He was admitted for chronic pancreatitis, and he has a past medical history of alcohol, ETOH abuse. The doctor did prescribe him Ativan, PRN 2 milligrams every 4 to 6 hours in case he exhibits any withdrawal symptoms. He's also on hydrocodone pain medication, 10 milligrams as needed. He's complaining right now because he feels his pain management has not been adequate, and he's threatening to leave against medical advice. The UAP went in there earlier, and she thought he was messing around with his clothes. So I figured you might want to discuss with him the issues with me. We can go in together and talk about that.
What's his name again?
His name is Bill, and his doctor is Dr. Painful.
All right.
All right.
Knock, knock. Hey, Bill. Hi, I'm Stephanie. I'm your nurse for the day.
No, you're not. I'm going home.
You're going home?
Yep.
Well, what's making you do that?
Well, I came here and I'm not getting any pain relief, and if I'm gonna be uncomfortable, I'd rather be uncomfortable at
So
home.
you're not getting enough pain medicine? Is that what you're? Well, the thing is that with your pain medicine, it's at a schedule. We have to give it at a scheduled time, so it's probably not time to give it yet. Do you
Can we
think?
talk to someone about that? Can we get an increase?
I can call your doctor and I can have him come and we can talk about what would work for you, and we can increase your pain pill dosage. Would that be okay?
Well, I mean, I guess if it's gonna happen in the next little bit, like, I just don't want to be uncomfortable here anymore.
Okay, because if you go home, we'd have to have you fill out a form saying a release form, and we'll have to talk to your doctor. And then if you go home also with your pancreatitis going on, that could affect your heart, and that is worse than what's going on right now, and we really don't want that to happen.
Well, that's not good
So
either.
I can talk to your doctor and we can think about getting something for your pain. Do you want like a hot pad or a cold pad or something that might help too?
No, just tell me what the doctor says.
Okay, well I will call home and I will be in here when he gets up here, okay?
Okay.
Okay. Well, it was nice meeting you. We'll have a good day today.
It was nice working with you. I hope you get feeling better, okay? All right.
Well,
Stephanie's going to take good care of you.
yeah. Well, now since we've done that, I'm gonna fill out like some plans for what I'm gonna do today, so I can get a list of what needs to be done. I think these people are gonna be okay.
Yeah, is there anything I can help you do before I leave?
You
to
know,
help transition.
I think you helped enough. I think we'll be okay. You
All right.
go to sleep.
Okay, I'm
All
going
right.
to go to sleep.
Okay.
Have a good day, Stephanie.
You too.
All right, bye-bye.
Okay, bye.